Pregnancy, whether anticipated or surprising, can be among the most exhilarating moments in a woman's life. However, it can also be one of the most nerve-wracking times, as a woman will experience not only physical difficulties and discomfort, but also a lot of emotional upheavals. During the next 9 months, a woman will encounter a broad spectrum of challenges as she contemplates her growing baby and considers how best to care for him or her. In the initial stages of pregnancy, a woman may observe one or more of the following common symptoms: nausea or vomiting, unusual fatigue, breast tenderness, frequent urination. Around 6 to 10 days after fertilization, the egg makes its way to the uterus and implants itself into the uterine wall, known as the endometrium. The endometrium is responsible for providing oxygen and nutrients to the developing embryo. Approximately 4 weeks after the start of the last menstrual period, just prior to the next period, the blastocyst initiates the production of the pregnancy hormone, which signals the ovaries to halt the release of eggs. From that point forward, the menstrual cycle is paused, and the blastocyst is referred to as an embryo. Home pregnancy tests have the potential to yield a positive outcome. Around week 5 of pregnancy, the circulatory system, brain, and spinal cord begin to take shape, and the small heart commences beating. In fact, the baby's heart will pulsate approximately 54 million times prior to delivery. The placenta furnishes the growing baby with oxygen and nutrients while eliminating waste materials from the baby's bloodstream through the umbilical cord. During week 6, the nose, mouth, and ears begin to take form. At weeks 7 and 8, the embryo has doubled in size compared to the previous week. Between weeks 9 to 12 of pregnancy, the fetus begins to develop small hands and feet. At this stage, the embryo is referred to as a fetus. The baby is nearly completely developed and has finished the most crucial aspects of fetal growth. Facial features become more recognizable, and the fetus's head is turned and flexed towards the chest, allowing the baby to occasionally touch its face. The muscles of the diaphragm begin to develop, while the reproductive, circulatory, and urinary systems are all in an advanced stage of growth. The fetus will excrete urine into the amniotic sac, indicating the healthy functioning of its body. If the baby is female, her ovaries will contain millions of eggs, while a male fetus's testicles will begin producing testosterone, a vital male sex hormone required for the development of his reproductive system. At this stage, the fetus measures approximately 5 centimeters and weighs around 14 grams. The level of HCG pregnancy hormone reaches its highest point at around 9 months. However, starting from week 9, the level of this hormone will stabilize, and many unpleasant symptoms such as morning sickness and fatigue will gradually dissipate. By now, the mother will have noticed changes in her own body, such as an increase in the size of her uterus, which will fill her pelvis. The mother may be feeling well enough at this point to enjoy her meals and potentially gain a little weight.